What conditions make a cystoscopy necessary? Imagine being able to see inside your bladder without surgery. That's what a cystoscopy offers. It's a common procedure doctors use to look directly into the bladder and urethra with a tiny camera called a cystoscope. But when do doctors decide it's time for this test? Several medical conditions can make a cystoscopy necessary to help diagnose and sometimes treat bladder issues. One of the main reasons is if you notice blood in your urine, a condition called hematuria. Blood can come from many sources inside the bladder, such as tumors, stones, or infections. A cystoscopy allows doctors to find the exact cause by visualizing the inside of your bladder directly. If you have ongoing urinary tract infections that keep coming back despite treatment, a cystoscopy can help identify underlying problems like structural abnormalities or stones that might be causing these recurrent infections. Cystoscopy is also vital in diagnosing and monitoring bladder cancer. It helps detect tumors early, take tissue samples for biopsy, and check for recurrence after treatment. If you experience lower urinary tract symptoms like painful urination, urgency, frequent urination, incontinence, or difficulty urinating, a cystoscopy can help determine whether these symptoms are due to bladder or urethral issues. Sometimes, symptoms like chronic pelvic pain, interstitial cystitis, or urinary blockage have no clear cause. In such cases, direct visualization of the bladder with a cystoscope can reveal hidden problems. The procedure is also used to detect bladder stones or foreign bodies that may be causing irritation or blockage. In men, cystoscopy can diagnose narrowing of the urethra caused by an enlarged prostate, which can obstruct urine flow. If urine tests show abnormal cells that might suggest cancer or other diseases, cystoscopy helps confirm the diagnosis by allowing doctors to see inside the bladder and urethra directly. Before or after certain surgeries, especially pelvic surgeries, cystoscopy can check for injuries or complications. It is also used to evaluate the bladder neck in cases of suspected obstruction or to assess the urethra in men with prostate enlargement. It's important to note that cystoscopy is usually avoided during active urinary tract infections because the procedure could worsen the infection. The procedure can be performed under local, regional, or general anesthesia, depending on the situation. In summary, a cystoscopy is a key tool in diagnosing and managing bladder and lower urinary tract conditions. It's typically recommended when symptoms or test results point to abnormalities in the bladder, urethra, or surrounding structures. Always consult with a healthcare professional to determine if this procedure is appropriate for your specific situation, as individual health needs vary.